Activa tu voz. Activate now.
Speak up, speak out.
Get involved, get involved.
Engage-toi.
Take action.
Aktiviere deine Stimme.
We're union and we're proud.
Welcome to Activate Live. I'm DeLane Adams, a communications representative here at the Machinists Union headquarters in Upper Marlboro, Maryland. On today's show, we will talk with the IAM Director of Healthcare, Marti Garza. He will discuss the COVID-19 or coronavirus from the standpoint of healthcare workers, their issues, and why unions are so important in this time of crisis. And don't forget, you can comment at any time during the show. And now for our news of the week. As we speak, the Senate is aiming to vote today on the coronavirus relief bill, legislation that will get the nation's economy back on track by providing much needed resources for America's working families. And also, in other news, New York City will hire out-of-work TLC drivers. The Independent Drivers Guild, a Machinists Union affiliate, issued a statement. New York City's for-hire vehicle drivers have seen their earnings plummet amid this pandemic. Drivers are ready to step up to help the city in this time of great need. We are thankful that the city sees the value in this workforce and appreciate the commissioner's hard work to make delivery TLC a reality. And members of the Machinists Union Local 1406 in Wisconsin are in a race against the clock to produce ventilators needed in this worldwide fight against the current coronavirus pandemic. Let's take a look at a video produced by Michael Kleinfeld, senior video producer at the AFL-CIO.
Every ventilator we get off the end of our line is saving a life. The term, this is a wartime situation, has definitely flown around our plant quite a bit. My sister, for example, she's a doctor in Cincinnati. So you could say she's definitely on the front lines right now. And I guess I'm kind of in the background putting the machines together. We are not going to shut our doors. When everybody else is out there really stressing out about what's going to happen in the future, we can't really dwell on that because we got to get this stuff done and we got to show up every day and get as many of these machines out to the people all over the world. People will start to burn out and it'll be hard to continue the upswing of production. That's kind of where being in a union and being brothers and sister comes into play. You just kind of keep each other motivated, make sure people are staying healthy, getting enough to eat, getting enough to sleep. If they need to talk about things, you got to listen. That definitely helps. I would say that just keep up the faith. I know that my coworkers, we're going to show up every day and we're going to get as many out as we can.
Oh man, great video. I want to thank our members at Local 1406 again for just being on the front line and stepping up to meet the sudden increased demand for these ventilators all across the globe. And joining me now is Marti Garza. I am Director of Healthcare. Marti, welcome to the show.
Thank you, DeLane, to be here.
First, let me thank all our IAM members who are on the front line and who are working in essential jobs. That brings us to why we have you on the show, Marti. What does COVID-19 mean for our members and other workers in the healthcare industry?
Well, so as you and many of our members might know, we have several thousand IAM members that are frontline care providers and that are literally dealing with this crisis as it evolves. And there is a variety of issues right now facing not just our members who are healthcare workers, but also healthcare professionals across the country. First and foremost is the issue of personal protective equipment. As people have seen in the news recently, right, COVID-19 is pretty virulent and it spreads very fast. And so the ability for our members and other healthcare professionals to have access to adequate personal protective equipment is really important. Another issue that's facing of our members and other healthcare professionals is the question of staffing levels. As this pandemic grows and spreads, it's going to be important that there's adequate staffing to deal with the acuity and the sick folk that are going to come into our health system. And so you may have seen on Facebook, right, healthcare providers saying, we're showing up to work, so you should stay home for because that our system could get overloaded. Staffing in some places is pretty lean as it is.
Okay. And Mark,
Uh,
so what are we
yes.
doing? What is our union doing to support these healthcare professionals?
On several things. We're very active and very aggressive on Capitol Hill right now, making sure that all the relief packages that are being passed, include resources for healthcare professionals across the country. The IAM was one of the earliest supporters of the COVID-19 Healthcare Worker Protection Act, introduced
Okay.
by Representative Bobby Scott of my state of Virginia and Senator Tammy Duckworth in Illinois. And that's really important to make sure that our healthcare providers have access to all the resources they need to battle this virus and make sure that the rest of us stay healthy. We as a union have issued guidelines for bargaining with employers regarding COVID-19. So many of our local lodges are engaged in impact bargaining over the effects of COVID-19 and what it's doing to the workforce. When it comes to healthcare workers, this is where we can really stand up and step up and say we need access to equipment. We need adequate isolation rooms. We need all the things to make sure that our community is safe. We've also got our EAP and addiction services program running. This is a very stressful time for working men and women, and they need access to resources. So the IAM has a very robust EAP and addiction services program. So that's out there, helping people deal with the stress of the crisis. And then finally, as you saw, right, our local lodge up in Wisconsin, 1406, is producing ventilators directly, right? So having a very direct impact on the ability of healthcare professionals to tackle this problem.
So as we go forward and we're dealing with this crisis, why are unions important to the healthcare industry?
I think that unions give workers a strong voice on the job to make the demands that they need to make to keep the rest of us safe. So whereas workers in represented workplaces have the ability to do impact bargaining about how COVID-19 is affecting their jobs, workers in non-represented places are basically at the mercy of corporations to make these decisions about their personal safety. And that's just not right. And the only way we have right now to tackle that is by bringing a union into the workplace to make sure that our healthcare providers have an unfettered voice to advocate for their personal professional safety and the safety of their patients.
Man, it's a lot of great work that's being done. Can you also give us an update on the IAM military family life counselors?
Yes, so over 300 military family life counselors voted the IAM into the workplaces at military bases and installations across the country. These are mental health professionals that provide mental health care, right, counseling services to our enlisted personnel. So it's very important because our enlisted personnel are experiencing a lot of stress. The DoD closed down travel domestically and internationally. COVID-19 is indiscriminate in where it strikes. So many of our personnel are at risk as well. And so our MFLACs, our military family life counselors right now, are in the middle of impact bargaining to figure out how can they continue to provide the services our enlisted personnel need while also maintaining the safety of themselves and their families.
So Marty, what can we do as an audience, people listening in, what can we do to help to make sure that healthcare professionals are getting everything they need? What can we as a general public?
Yeah, I think first and foremost, we need to listen to the healthcare professionals and their recommendations for what we should do during this crisis. That includes practicing hand hygiene. We know that works. Practicing social distancing, that works because it's not just about the safety of our immediate selves and family, but our communities at large. And healthcare professionals are out there advocating for us. So we need to make sure that we don't overload the hospital systems by being careless and reckless with our personal health so that they can tend to the most vulnerable among us. Then if you're an IAM member, you should visit Go IAM, our website. You can be connected to advocating to your legislative representative for the COVID-19 Healthcare Workers Protection Act and for all this other great legislation that our friends and allies in Capitol Hill are championing for men and women healthcare providers across the country.
Thank you, Marty. I really appreciate all the advice you give our audience. And again, we continue to pray for our healthcare professionals on the frontline responders, and again, members who are working in essential jobs. So thank you for joining us today, Marty.
Thank you. Stay healthy and be safe, brother.
Yes, you do the same. So, and again, we want to make sure everybody out there is being safe. We want to make sure we definitely take care of our family, take care of ourselves. And again, your union is here for you. Please go to goiam.org. Please look at all our resources. And we want to make sure our members who are in danger, who are suffering from some of the symptoms of coronavirus, that they stay healthy and they get better. Ones who may have lost a battle due to coronavirus, we pray for their family and hope they get well in the future. Again, that's it for this edition of Activate Live. Join us again next week at 3 p.m. Eastern via Facebook, Twitter, or YouTube. Thank you to Joe Heckman, who produced today's show. Under these circumstances, we really appreciate you, Joe. Thanks for watching. Again, please stay safe.